For the first time in a long time, life expectancy dropped in all 50 states and the District of Columbia in 2020. Here in the volunteer state, it fell by nearly 2 years. Mary Mays has a look at what caused this dip.
Tennessee's life expectancy in 2020 was 73.8 years. That's a drop of 1.8 years since 2019. Dr. Todd Rice at Vanderbilt says that while COVID did play a role directly in this dip, the indirect effects of the pandemic also contributed.
I think the other reasons are somewhat COVID related in that people during COVID, even if they didn't get COVID, didn't go get medical care. And so they wouldn't get their annual screenings. They wouldn't get, if they had diabetes or high blood pressure, they wouldn't go get their routine visits, their meds adjusted, and optimal care because of COVID and because of, all that was going on.
A decrease in cancer screenings during the pandemic may also be a factor.
There are lots of data emerging now that people didn't do their cancer screenings and that cancers are detected later and in a more spread form, a more dispersed stage now than they were before because people didn't get their screenings. And that's true for cancer and diabetes and heart disease and all of that.
Dr. Rice says that it may take some time for life expectancy to return to earlier levels.
I think it's going to take us a little bit to get back to people getting their screenings and people getting back on target for their visits, for their diabetes and their high blood pressure. And I think because we missed some of those visits and didn't optimize treatment during those time periods, I think we're going to see some effects of this for 5, maybe even 10 years down the road, which is the disease course for many of these diseases.
Mary Mays, News 2.
Hawaii experienced the smallest decline in life expectancy, falling by only 0.2 years between 2019 and 2020. The biggest decline in life expectancy was in New York, where it fell by 3 years.